First generation versus second generation H1 antihistamines. The clinical story of two medical students. A 22-year-old medical student develops severe sneezing and itching before an important exam. He takes an antihistamine. His allergy improves, but within an hour he is so drowsy that he can barely concentrate. His friend with similar symptoms takes a different antihistamine. His sneezing also improves, but he remains completely alert and continues studying normally. Both drugs block H1 receptors. So why does one cause marked sedation while the other causes little or none? The answer lies in one crucial difference: their ability to cross the blood-brain barrier. The key distinction: first-generation antihistamines are lipophilic, so they readily cross the blood-brain barrier and enter the central nervous system. This explains their prominent sedative effects such as drowsiness and impaired alertness. In contrast, second-generation antihistamines are less lipophilic and show minimal penetration across the blood-brain barrier. Therefore, they produce much less central H1 receptor blockade and are generally less sedating, making them preferable when daytime alertness is important. So, remember, greater brain penetration means greater sedation. First generation H1 antihistamines. Now, coming to first generation H1 antihistamines. Important examples include diphenhydramine, chlorpheniramine, and promethazine. These drugs have a relatively non-selective receptor profile. Apart from H1 receptors, they also act on muscarinic, alpha-1 adrenergic, and serotonin receptors, which explains many of their additional effects. Their duration of action is shorter, often requiring multiple daily doses. Clinically, they are used for allergy, motion sickness, vertigo, sedation, and as antiemetics. Their important adverse effects include sedation, dry mouth, blurred vision, urinary retention, and postural hypotension, many resulting from their actions on receptors other than H1. Second generation H1 antihistamines. Now, coming to second generation H1 antihistamines, important examples include cetirizine, loratadine, and fexofenadine. These drugs are more selective for peripheral H1 receptors and have minimal CNS activity. This is the major reason they cause much less sedation than first generation drugs. They also have a longer duration of action, which commonly allows convenient once daily dosing. Their major uses are allergic rhinitis and urticaria. In terms of adverse effects, they produce minimal sedation, have no significant anticholinergic effects, and are generally well tolerated. These properties make second-generation drugs particularly suitable for routine daytime treatment of allergic disorders.